I am Teresa Broadnax, and I am a Emmy-winning stylist. I've been a hairstylist for 25 years, a fashion designer for 10 years, and I also do makeup. I'd like to call myself the triple threat. I moved out to Los Angeles November of 2002. I decided to come out here. I had done, being in a beauty business, and I had started, doing a little fashion styling. And I decided that I wanted to do work in television and film. I had owned a salon for 10 years in downtown Columbus. I had done a few films, a lot of videos with a company called Ozone. I was their creative director out in Columbus, Ohio, and I felt like for me to really be in the mainstream of film and TV, I needed to come to LA. Luckily, once I got here, I did go work in a salon for a while because that was giving me some steady money, and I was building a clientele, and I ended up getting some clients that were producers and directors, and that's how I ended up over at CBS. And they brought me onto a project, and I pretty much have been, there ever since. I'm not necessarily a gym buff person because I just like to be outside. So I run the trails a lot, I put my music on, I kind of get into my zone. I love the beach, I think, the water. I used to be a lifeguard, so I have a very special love towards the water. I also just like to relax, just to come back here in my backyard, and it's very peaceful. I've always been pretty good with, I go to get my checkups, and I'm definitely been a person who took care of that. I've never really been in the hospital or sick of anything besides, having giving birth to my children. And I just went for a routine checkup, and we did a mammogram, and they said that they see something that shouldn't be there, so they did another mammogram and it definitely was something there. So then of course we did an ultrasound, which once they did the ultrasound, you could clearly see, because mammograms are kind of it looks like it is, but you're not sure or whatever. But the ultrasound, you definitely have a clear vision of, that there's something there. So, and then at that point, I still wasn't assuming or just I didn't go into frantic mode and just say, oh, I'm probably going to have cancer. I mean, it could be a cyst, it could be anything. It doesn't necessarily mean it's going to be something to that magnitude. So I kind of kept, a cool cool head about it and didn't think the worst. I'm not a person who kind of thinks, the worst or go to the negative side. And but then of course once we did the biopsy, because that's the next thing they do. It came back that it actually was cancer. I was a little shocked. Not saying that it couldn't be me, but I think because I didn't really have a history of it. So I think a lot of people, you don't really think about it. It's out there. It could happen to any one of us. But you don't. I think if you don't really have a family history of it, it's not something that's something that you really think about all the time. I was always cautious about staying fit and active because I knew that, high blood pressure, diabetes, and things like that ran, on my mother's side of the family. So that's why I was always cautious about staying healthy and staying fit and that type of thing. I didn't really think about cancer, a lot, because I felt like I didn't really have the history to, make me really think that way. And I actually was the first person to get diagnosed, to my knowledge anyway, of close family with breast cancer. So, so I just kind of took it all in and just, I just said to myself, well, I'm the type of person that, it is what it is, and I'm just gonna, research, get all the information that I can get, listen to what the doctors have to say, and then take from research and what they're saying and just do the best thing that I think the best choice for me to do and just try to, you know, take care of it from that point.
My name is Dr. Travis Kidner. I'm a surgical oncologist and a board-certified general surgeon. I practice at the Rocks Cancer Center in Beverly Hills, California. So the first time I see a patient, it's really about collecting all the information. I do a complete history and physical, including family history, to see if there's any reason to do genetic testing. Also, I review all of the information that we have, mammograms, MRIs, and breast biopsies. If any additional testing needs to be done at that time, this is when I order it. Also, the first visit is a good time to introduce the patient to the entire team that's going to be taking care of her. Breast cancer is really a team approach. You have your surgeon, your medical oncologist, possibly your radiation oncologist, and the referring physician all together to take care of you.
Well, I was diagnosed at first like a stage 1. Once they went in and did my first surgery, and I had already chose to do the double mastectomy before I knew that I had cancer in my masses in my lymph nodes as well. I was just like a 1B at that point, stage 1B. And I said, no, let's just do the double mastectomy. I don't want to just do one, you know, breast and then, you know, 5 or 10 years later, it comes back and then I got to go back and do the same thing over again. So let's just do both. And I'm okay with that, but I'm glad that I made that choice, and my doctors was happy that I made that choice, because once they went in and did the first surgery, I also had 3 cancer masses in my right lymph nodes that were larger than the mass that was actually in my breast. So I actually did make the best choice to just go ahead and do it, because that told them that it actually was starting to move through my body at that point. And when your chances of it coming back are greater if there's tissue still there. So I felt like, let's just remove all the tissue, do some implants, and that takes my percentage of it coming back down really low to like 3%, I believe.
Breast cancer first metastasizes or travels to other parts of your body through the lymph system. The first place it'll stop is a lymph node underneath the arm. The very first lymph node that it travels to is called the sentinel node. So a procedure often done for breast cancer is a sentinel lymph node biopsy. How this works, in the operating room, blue dye is injected into the breast, and the blue dye travels through the breast and it stops at the first lymph node, turning it blue. And then a small incision is made in the armpit, and the surgeon looks for the node that has turned blue. These nodes, 1 or 2 nodes, are sent off for pathology and are evaluated. If there are no cancer found in this lymph node, that means the likelihood of the breast cancer spreading is lower. However, if these nodes do have cancer in them, in most cases your surgeon will recommend to have an axillary lymph node dissection. This involves removing all of the lymph nodes underneath your arm.
When I went into the first surgery, that's like the deconstruction of, you know, removing everything. It's basically for a double mastectomy anyway. The cancer doctor came in, you know, takes out the breast, and then the reconstruction doctor is there at the same time to they put temporary implants in you, which are called expanders. And then you have expanders in, and you while you go through your treatment, whether it's chemo and or radiation. And like once every couple of weeks you go in and they fill the expanders up with saline to basically keep to stretch the skin and keep the skin ready and that area ready for the permanent implants that will go in after your chemo treatments. It was pretty invasive surgery. Out of all the surgeries, I had 4, and out of all of them, that of course that's the most invasive surgery. And you know, I didn't feel very sexy. You don't feel very sexy because it's like, you know, I hadn't lost my hair yet because I hadn't quite started chemo at that point. But you know, your breasts are gone. You're wrapped up pretty much like from waist up like a mummy. You can't really do anything. You can't lift your arms. You can't take a shower because you can't get wet. So you have to take like little bird baths or wash up because you can't get any of your upper body, you know, wet. So that's kind of like, you know, very discomforting just that alone. So, but then, once I started the chemo, pretty much right at a couple weeks after the surgery, then, I lose my hair like a few weeks after that. So you don't feel very womanly or very sexy. I wouldn't say that I felt less than a woman, because I still felt like a woman, but you don't really feel like yourself, and you definitely don't feel sexy. I had a dream team, as I like to call them, at Cedars-Sinai. I was blessed to have, really good insurance, motion pictures insurance, which is really like the best insurance you can have in the industry, which enabled me to get, a top-notch team. My reconstruction doctor was David Colbert, who's the chief of surgery, of reconstruction surgery at Cedars-Sinai. And between him and a few other doctors, I just had the best team, really supportive. He actually would say that I was like one of his best patients. He just couldn't believe how positive and upbeat, and we kind of got a little teary-eyed when it was my last visit to see him, because I had spent so much time with these doctors. When he told me that this was the last time that he was going to have to see me unless I was having some problems, we just kind of hugged each other, because I had actually formed a bond with these doctors, and I was just so happy with the outcome of all my surgeries. And I just been very blessed in that way, because I know that that's not every woman's experience.
One thing that I think patients forget sometimes is that they're in control of the team. They need to feel comfortable with their surgeon, the radiation oncology, and everyone on the team. If there's a part that's not working for them or they feel uncomfortable with, that might be the time to get a second opinion and to seek other options. A patient's attitude towards their diagnosis and their treatment is huge. To have a positive attitude going through dealing with all these situations and having the support of their family and their medical team makes all of the difference in how the patients do long term.
If I just found out someone was diagnosed with breast cancer, I would first tell them to stay positive and have faith. And I would also tell them to get a team of doctors, the best team of doctors that they're able to get for whatever their situation is, and to definitely do your own research. Go in with knowledgeable, get some facts about what it is that you're dealing with, and ask as many questions to the doctor as possible. Knowledge is really powerful, and it will help you in what decisions that is best for you to take. I had a friend ask me, well, did you ever ask yourself why you? And I told her, I said, no, why would I think not me? I'm no different or no special than anyone else, so why not me? I've never questioned God's will. It happened. This is what I need to do, to get through it. And so that's what I did, and I felt like, keeping my faith, I was going to be okay. Here I am. I'm okay.